Hello, everybody, and welcome back to my channel. You know, healthcare is confusing, and sometimes it feels like the people making the rules don't have to live with the consequences of said rules. So today, I'm breaking down Trump's great healthcare plan versus the Affordable Care Act, which is also known as Obamacare. Now, there'll be no big words, no talking over your head, just real understanding. So I'm asking you to please stick with me through this whole video because toward the end, I'm going to show you how this could affect your family's wallet. And that part matters. You know, Proverbs 4:7 says, wisdom is the principal thing. Therefore, get wisdom, and with all thy getting, get an understanding. And that's our goal today, understanding and not headlines. Now, before we jump in, can I get you to do me a quick favor? Go ahead and subscribe. The more people that are engaged, the more this video gets pushed out, which means more people get empowered with real information. The administration is calling this Trump's great healthcare plan. According to the administration, the idea is to lower drug prices, give people direct cash to help buy insurance, show healthcare prices up front, and cut out the middleman. Sounds real good, doesn't it? But I think we need to slow it down and we need to look at it very close. Now, you might be asking, who does this affect? This mainly affects three groups: Medicare users, people with pre-existing conditions, and families buying ACA plans. Now, seniors might see cheaper prescriptions. That's a positive. But protections for pre-existing conditions are not written into law yet. And families buying their own insurance, they will get about $2,500 and be expected to cover everything else. Now, let's look at this breakdown that compares the ACA Silver plan to the CSR Trump plan. Now, you can see the monthly premium is cheaper under Trump's plan. However, it goes downhill from there. Your deductible and out-of-pocket max are higher, and you only get $2,500 in cash. You see that? You might save on premiums, but when someone gets sick, the bills are higher. Now, let's talk about this notion, cutting out the middleman. Trump says he's cutting out the middleman. And as a licensed insurance agent with the state of Georgia, I cringe every time I hear this repeated. Here's the truth. You'll still be dealing with insurance companies. You'll still be dealing with hospitals and claims. And so the only thing changing is who gets the government's money first. Is it you instead of the insurer? So no, the middleman isn't gone. The system is still complicated. The responsibility will now shift more onto the consumer, who has no power to negotiate anything with these large TPAs. So the plan leans on HSAs and cash payments. Now, I've talked about this at length in my other videos. High deductible plans and HSAs, they work if you're what? If you're healthy. But if you have diabetes, asthma, cancer, or kids who get sick, guess what? That $2,500 is going to be gone so fast. Now, I feel the need to explain this really quick. The acronym, you heard me say CSR. CSR, it stands for Cost-Sharing Reductions. That's what lowers deductibles, co-pays, prescriptions, and out-of-pocket max for lower income families. CSR helps when you go to the doctor. Okay, Trump's plan is only going to give you cash. and it's going to leave families to figure out the rest. Now, there's one real positive, and that's the drug prices. The drug prices could drop for some medications, and that's going to help seniors. But it only works if this plan actually becomes law. Now, let's talk about the pros and the cons. The pros of the Trump plan is supposedly lower drug prices, more transparency, more choice for healthy people. The cons of this plan, you're only going to get $2,500, which isn't enough for serious care. And then another biggie is pre-existing protections are unclear. And then guess what? You're still going to have those $6,000, $7,000 high deductibles. And then chronic illness, people with chronic illness, those families are going to end up having to pay more out of their pocket. Now, here's the bottom line. If you're healthy, this might save you a little. But if your family has real medical needs, this plan could cost more. And healthcare isn't about politics. It's about who? It's about who? It's about people. So remember, Proverbs 4:7 says, with all thy getting, get an understanding. Because guess what? Cheaper premiums don't always mean cheaper healthcare. You got to look at the numbers. Now, if this helped you, like the video, subscribe, and share it. The more we understand, the more we empower each other. I'm Terry Small, your benefits mentor, helping you make smart benefit choices, one video at a time.